Shalom, Sisters of Israel. This is an article I want to share with you out of Forbes magazine. It has to do with a healthcare related topic, and the title of the article is Super Gonorrhea May Be Spreading from Antibiotic Overuse for COVID-19 Coronavirus. So I'm going to go down to the second paragraph of this article, and it reads, if you haven't figured it out yet, super gonorrhea is not super to have. It won't prompt you to tell your partner, I just returned from the doctor's office and I've got super news for you. Nah, telling him or her that you have super gonorrhea will be about as positive as saying that you have sexy syphilis or candy-coated chlamydia. Super gonorrhea isn't a comic book hero either, in case you are wondering. So, like if I heard that from a sister that I came across, I would just share scripture with her. And I would say, I would be reflecting on a scripture such as, for example, I would share this with her. Hebrews chapter 13, verse 4. Marriage is honorable in all, and the bed undefiled, but whoremongers and adulterers God will judge. So I would just think about things like that to share with her. And then, even if I wasn't sharing it with a sister, I was reading an article, I would reflect on scriptures, and just as I'm reading things in the news, oh, okay, how can I compare that with the scriptures in the Bible to see how that matches up with that, and what can I learn from reading this article, and then go back to my Bible. So It says instead, supergonorrhea results when the bacteria that causes gonorrhea, Neisseria gonorrhea, develops a high level of resistance to the antibiotics normally used to treat the infection. Azithromycin, which is an antibiotic, and ceftriaxone. As I reported back in 2017 for Forbes, the World Health Organization listed such strains of gonorrhea on its world's most dangerous superbugs list. When making your bucket list, don't include anything on this WHO superbug list. We've run out of ways to treat your infection ranks up there with no one can fly the airplane, or the hull of the cruise ship that you are on is made out of pickles. On the list of things that you don't want to hear. Then in 2018, I covered for Forbes a case of a man from the United Kingdom who had had a super sexual encounter while traveling in Southeast Asia. The man developed symptoms a month later and was diagnosed with super gonorrhea. As a result, the man's regular partner in the UK had to get tested, but she fortunately tested negative for the superbug. It's not clear whether this couple remained together after the super revelation. After all, things like not knowing how to tango or infecting you with super gonorrhea can be deal breakers for some when it comes to dating. If the relationship did continue, the woman would have had quite a card to raise in future arguments, such as, what you won't take out the trash? Well, remember that time you had sex with someone else and almost gave me super gonorrhea. So this is the article in Forbes magazine. So why is super gonorrhea trending on Twitter when there are so many other things that can trend? Well, there are different possibilities. But it looks like the trending stemmed from a WHO spokesperson telling The Sun that the overuse of azithromycin and the lack of services to treat sexually transmitted infections or STIs during the COVID-19 coronavirus pandemic may be fueling the rise of super gonorrhea. Not the sun as in that fiery ball in the sky that you shouldn't look at even during an eclipse, but the sun as in the UK publication. Indeed, use azithromycin more often can select for more resistant versions of gonorrhea. Remember earlier this year when some were touting the use of azithromycin along with hydrochloroquine to treat COVID-19? And some political leaders jumped on this bandwagon. This was even before well-constructed and executed clinical studies were done to assess the safety and efficacy of such medications for treating severe acute respiratory syndrome, coronavirus 2, which is also known as SARS-CoV-2 infections. So this was an example of premature medication. Since then, clinical studies have not found enough evidence to support such use. In a commentary in The Lancet, Catherine E. Oldenburg, PhD, an assistant professor, and Thu Duong, MD, PhD, and associate professor at the University of California, San Francisco, concluded for patients with COVID-19, the addition of azithromycin to existing standard of care regimens does not appear to improve outcomes. After reviewing results from the Coalition 2 trial that evaluated adding azithromycin to hydroxychloroquine, and standard of care to treat patients hospitalized with severe COVID-19. As a result of the scientific evidence that has subsequently emerged, the National Institute of Health COVID-19 Treatment Guidelines panel now recommends against the use of chloroquine or hydroxychloroquine with or without azithromycin for the treatment of COVID-19 in hospitalized or non-hospitalized patients. So it goes on to show, it says, there's a picture here, and it says a worker is engaged in producing the azithromycin antibiotic at the Hemic pharmaceutical company, azithromycin was registered by the Russian Healthcare Ministry on June 23, 2020, and included in the guidelines for the treatment of COVID-19 patients. For everyone who may have said, what's the harm in continuing to use azithromycin to treat SARS-CoV-2 infections? Well, here's a super response. Using antibiotics indiscriminately on infections, diseases as if the medications were Nutella can encourage the growth of resistant organisms. Antibiotics like azithromycin are considered broad spectrum because they can kill or inactivate a wide range of different bacteria. It's like using a bomb rather than a rifle. That can be helpful when you don't know what is causing infection or when there is no other option. So it's like, like for example, using a rational approach to developing something to treat a condition or irrational approach. So let's go on with the article. It says, however, every time you use a broad spectrum antibiotic rather than a treatment that's a lot more targeted and specific, you risk wiping out friendlier bacteria and weaker versions of a pathogen like gonorrhea, leaving stronger, more resistant versions a more open field to flourish. The remaining stronger ones then multiply and become a lot more predominant. This is how more resistant versions of the bacteria take over and spread. In the US, the 5 years from 2013 to 2018 saw an over sevenfold jump in the percentage of gonorrhea samples that are less susceptible to azithromycin from 0.6% to 4.6%. The rise of azithromycin resistance in gonorrhea has prompted a December 18 change in the Centers for Disease Control and Prevention (CDC) guidelines for treating uncomplicated gonorrhea. Rather than a two-drug azithromycin and ceftriaxone approach, the CDC is now recommending just one 500 milligram injection of ceftriaxone. By uncomplicated, the CDC means your run-of-the-mill gonorrhea infections of number 1, your urinary tract, number 2, your rectum, your genital areas, or your throat. If you don't know how each of these places can be affected by gonorrhea, you may need to retake sex education. Of course, more complicated gonorrhea may require antibiotics. One problem with COVID-19 coronavirus pandemic is that other pathogens haven't necessarily taken a break. They haven't spent most of their time on Zoom calls, muting each other and using the video filters while saying, hey, look at me, herpes, with a hat. While humans' social distancing may have limited the spread of some pathogens, such as influenza, others may have had a good 2020. So just a picture in the article, and this under the picture it reads, the COVID-19 coronavirus pandemic has either closed or limited the efforts of clinics and other efforts that normally aim to reduce the spread of sexually transmitted infections. And then the article goes on to read, after all, the pandemic has not only prompted doctors to try different antibiotics to treat COVID-19 coronavirus, it has also reduced the availability of doctors to properly treat STIs. The pandemic has shut down many non-essential health services or dissuaded many patients from seeking proper medical care. Therefore, people may be running around while untreated infections or trying to self-treat with potentially inappropriate antibiotics. As I've said repeatedly, the COVID-19 coronavirus pandemic has been exposing many of the problems that have already existed in society. Antibiotic-resistant bacteria is one of them. If nothing is done to better tackle this looming problem, pathogens like super gonorrhea will be far from gone, in 2021 and beyond. So I hope you enjoyed this article. You can look it up on Forbes magazine. And although we're not associated with any other organization and we don't share their views or their philosophies, it's good to read over healthcare related topics and kind of compare them to the Bible. So with that, I like to say all praises to the Most High in Christ blessed. Shalom. Shalom. Welcome to Fruitful Possession, a nonprofit organization. My name is Sister Jemima from the House of Jacob. Welcome to the Sisters of Israel. Today's class will cover prenatal care and also we'll go over vitamins and minerals and how it's very important to have these elements in your body, especially during a pregnancy. So let's get started. So today I'm going to cover some information out of this book. It's called Prenatal Care. So although we're not affiliated with any other organization and we don't share their views or their beliefs, this is for educational purposes only. So I'm going to go to page 2 of this book. This is Prenatal Care, and this book was written by Childbirth Graphics. It says, Prenatal Care, having a healthy baby. Did you know that all of your baby's major organs are formed in the first 12 weeks of pregnancy? All praises to the Most High. So we just learned so much information in that one paragraph that when you are expecting, you and your husband, your Lord, and yourself are expecting a new Israelite baby boy or a new Israelite baby girl, your baby's organs are formed within the first 12 weeks of life. You know, and that's wonderful to hear information like that for the 12 tribes of Israel. All praise the Most High. So it says, during these first weeks, when her baby's heart, lungs, and brain are rapidly developing, a woman may not know that she is pregnant. So it's very common for a lot of expecting couples not to realize that they are expecting a child at first. It could be their first child and they didn't recognize the signs of pregnancy. It says she may even be putting her baby's health at risk by engaging in activities that aren't safe for pregnant women. The health of your baby starts even before you conceive. So it's a really good idea to really consider thinking about taking prenatal vitamins to get your body together, learning how to eat much more healthier, getting your body in the best shape possible. And it's really a good idea to actually get like a physical exam before you consider having children. It says studies show that the earlier in her pregnancy a woman begins prenatal care, the fewer problems she has during pregnancy and birth, and the healthier her baby is. If you prepare yourself physically and emotionally before you get pregnant and stay healthy throughout your pregnancy, you can reduce your baby's risk for health problems. The greatest gift you can give your unborn baby is to take care of yourself. Develop a prenatal care plan that includes choosing quality health care, eating properly, getting enough exercise and rest, and avoiding harmful substances and activities. Help to ensure that the life in your womb continues to thrive. So let's go back to where it says, develop a prenatal care plan that includes choosing quality health care, eating properly, getting enough exercise and rest, and avoiding harmful substances. So, there's the scriptures in the 1611 King James Version Bible that talks about when you're actually picking out healthy food, things like that. It will, all praise the Most High, mentions a lot of things about eating healthy, don't overindulging, you're supposed to not be drunker, things like that. So I'm going to share, first of all, Titus 2:3-5. So let's go to the 1611 King James Version Bible, and we're going to go to the book of Titus, chapter 2, 3-5. And it reads, "Be aged women likewise, that they be in behavior as becometh holiness, not false accusers, not given to much wine, teachers of good things, that they may teach the young women to be sober, to love their husbands, to love their children, to be discreet, chaste, keepers at home, good, obedient to their own husbands, that the word of God be not blasphemed." So all praise to the Most High. So those are really good things to know. And I also want to share another one. Let's see. Let's go to the Apocrypha. And let's talk about health and good estate. So I'm reading out of the Apocrypha, and there's a book called Ecclesiasticus, or the book of Sirach, Sirach. And I'm going to go to chapter 30. Verses 15. Health and good estate of body are above all gold, and a strong body above infinite wealth. There is no riches above a sound body, and no joy above the joy of the heart. Death is better than a bitter life or continual sickness. So that's just some scriptures I wanted to share with you regarding that. And there's a lot of different scriptures as well. It talks about not overeating, things like that. A little is sufficient for a body well nourished. So you may want to reflect on those as well when you're thinking about, how much is adequate, as well as consulting with your doctor or your midwife regarding your nutrition needs, what weight you should be at, vitamins and minerals. All right, so I'm going to go on to page 3 of this book. It says, choosing a healthcare professional. Choosing the person or clinic that will provide your healthcare is an important decision. So choosing a setting for your delivery of your Israelite baby. So that could be in a hospital setting where you will see an OBGYN doctor or a midwife, or you can also select a birth center where it's much smaller and the stay is much shorter, and that's a group of midwives that runs that. Or you may select a home birth, which you can control much of the environment. And of course, you have to consider what are the procedures for COVID-19 in a hospital setting, in a birth center, or in a home setting as well, when a midwife is coming with her team. All right, so let's go on. I'm on page 3. It says, before you try to conceive, have a thorough physical examination. During this visit, you and your healthcare professional should talk about any previous or current medical conditions that could affect your pregnancy. You should also map out a basic plan for becoming as healthy as possible to prepare your body for pregnancy. Some of the issues your healthcare professional might discuss in your preconception planning are weight, nutrition, vitamins, and they would even talk about immunizations. So those are some of the things you may consider. And, you might think, okay, well, I do need to get in much better shape. I'm getting ready to get married. And so my Lord, my husband, and I will certainly want to grow our family, or you just got married and you said, oh, okay, yeah, I'm in pretty good shape, but let me see what else I could do as well. I wasn't taking prenatal vitamins before. I'm eating healthy, but I wasn't taking prenatal vitamins or something like that. So you want to go over that with your doctor or your healthcare provider. So I'm going to focus on today is what's involved in a prenatal exam. What does that involve with prenatal care? And I'm going to go over nutrition and vitamins today. So let me go over to page 4. So I want to go first on what is the schedule for like prenatal visits. And it depends on what stage you are in your pregnancy. So on page 4 it says your prenatal visit schedule. So you'll go over this with your doctor, your midwife in a hospital setting or a birth center setting, or even at home. And they have virtual technology now, so you can have a lot of your visits by phone on using an app for a virtual office visit or on your computer. So that's very convenient for many families. So it says typically in a pregnancy with no complications or special concerns, you will have healthcare appointments once a month until late pregnancy, twice a month during your 7th or 8th month, and every week after that until delivery. So if there's no complications, like for example, if you are not pregnant with twins, right, or you're not at an older age when you got pregnant, you're at a great age, you may be like 25, or you may be 30, or you don't have anemia, you don't have high blood pressure, you're not overweight, you don't have a long history of drug abuse past, prior to you coming into the truth, of course, right? Or things like that, they got to monitor. Or you may have had a history of a miscarriage before, so they want to monitor things like that. So that's considered like a healthy birth if you don't have those things. But if you do, that's considered like a high-risk pregnancy. So let's go on. It says, at these visits, your healthcare professional will check your weight, blood pressure, and urine. So it depends on the setting. If you had it at a birth center, if you went for your prenatal care at a birth center, for example, it's more you take more control of it. You may go into a bathroom and you take your own urine. You collect your own urine. You test your urine with like a little swab, and it has different colors on it, and it'll tell you if your urine is normal or is abnormal, for example. And it's more personal in a birth center. You may do it in a sitting room or a living room setting or something like that, or in a birth room setting. So it's very natural. In a hospital setting, the nurses and the doctors will take over, where they will check your blood pressure, check your weight, with their healthcare team. And of course, it will be with COVID-19 procedures. And in a home birth setting, it's even more personal as well, where you can control the environment as well as watch what they do, as far as learning that. All right, so it says, at these visits, your healthcare professional will check your weight, blood pressure, and urine. Your abdomen will be measured periodically to see how much your baby has grown. Pelvic exams and blood work are not usually done at every visit. So where it says your abdomen will be measured periodically. So when a midwife, for example, measures your abdomen to see how your fetus is growing, they will start from your pelvic bone and then move their way up toward the fundus of the uterus to see how far the baby has grown. Like if they want to date it, and they'll say, okay, let's check you today. They'll have you lie down, and they will measure you. They'll take out a tape measure, and they'll measure you from your pelvic bone, and they'll go upward towards your belly button, for example. They're looking for the fundus to see where is the top of that, so they can see how long the baby is. So if they come up to, let's just say, okay, I'm measuring you, you're 13 centimeters. Okay, so I went from your pelvic bone up to your fundus of your uterus, and it is 13 centimeters. So you're about 13 weeks pregnant. All right. So it may even go, okay, I'm measuring you and it's 20 centimeters. All right, you went after that, they measure you again. Now you're 20 weeks pregnant. So that's how they do that thing. In a hospital setting, you may find that they'll do an ultrasound. So let's, to date the baby. So let's go on to that. It says, during your pregnancy, your healthcare professional may want you to have one or more tests performed to assess your baby's development. These tests may include ultrasounds. So you won't see an ultrasound in a home birth setting. You probably, it's a very good chance you won't see an ultrasound in a birth center. You will see it at a hospital setting. The hospital will have like all the major equipment, and they'll be prepared for like complications and major surgery, things like that. Birth centers, they rely on technique from palpation, visual, things like that, and the equipment that way to measure the length of the baby. So it says ultrasound. An ultrasound machine uses sound wave reflection to create an image of the developing baby. The ultrasound exam helps determine the age, size, and position of your baby or babies, because you could be pregnant with twins. It can also help identify certain types of birth defects. So although ultrasounds are good, they'll use that, for the first, they say, okay, you're pregnant. Okay, let's date the baby. So the first time you go, if you're going in a hospital setting, they'll say, okay, let's do an ultrasound. So they'll put some jelly on, they'll have you lay down, they'll put some jelly on your belly, and then they'll put the probe for the ultrasound on your abdominal area, and they're looking for the fetus. And when they do that, they'll be able to determine, how old the baby is, how many weeks pregnant have you been. In a birth center setting, they will use something called a fetoscope to listen to your heart, listen to the baby's heart. And they will palpate for the baby's appendages to see what the position of the baby, if the baby's head is down or the baby's lying transverse, or just to find where the legs and the arms are, things like that, the head, things like that. And they will measure and date the baby using a tape measure. They'll go from the pelvic bone and move their way up toward, for example, the belly button to identify the fundus. So here's another procedure I'm going to mention to you. So you may hear about these procedures, but you are ultimately in charge. Your husband and yourself, your Lord and yourself, you are in charge. You all are in charge of which test you would like to have, and you decide what kind of environment you would like to have your baby in. There are, when you do an ultrasound, sound waves are sent to the baby, so they get a little jolt when the test is being run. So some parents may say, okay, no, I don't want an ultrasound. This midwife, she will measure my baby. So there's more than one option for dating a baby. I didn't know. I thought I only could have an ultrasound to date the baby or check the baby. But I didn't know that a midwife could just use the tape measure and do it visually by, through palpation. So of course, we didn't always have ultrasound. So before this time, that's what midwives did. They measured the baby. They knew the position of the baby. They knew, how many babies there were as well. All right, so let's go into this other procedure you may hear about in a hospital setting. You don't hear about these in, home births or a birth center setting, but you'll hear about this if you have your baby at a hospital. It says, during your prenatal visit schedules, amniocentesis and chorionic villus sampling, or something called CVS. If you have certain risk factors or abnormal blood test results, your doctor may recommend one of these tests. During an amniocentesis, a needle is used to withdraw amniotic fluid for analysis. For CVS, a needle or tube is inserted into a pregnant woman's abdomen to remove cells that line the placenta. Both tests give your healthcare professional information about the health of your developing baby. So they're going to stick a needle in your abdominal area. They're going to go in the area where the baby's sitting. So a lot of parents may not want that. They say, no, I don't want that. So you have that right not to have that. Just to let you know, you do not. And You want to make sure you understand the informed consent form. You want to make sure you fill out an informed consent form and understand the informed consent form in your native language, so you can have a translator translate that information to you in your language if you don't understand. So that's good as well. Okay, so now I'm going to go on. I'm going to go into another book now. It's called, so this is another book that I'm going to share information to you about. We're not affiliated with any of this, but this is all this information is for educational purposes only. So this book is called Holistic Midwifery, a comprehensive textbook for midwives in home birth practice, Volume 1, Care During Pregnancy. It's written by Anne Fry. And so I'm going to go in here. So we're talking about prenatal care right now. So I'm going to go to page 549 and reflect on some information here. It says, the visit which follows the consultation will usually include a general review of medical history and physical examination. The initial history is handled in various ways by different midwives. So if you're seeing a midwife in a home birth setting or a birth center setting, they will handle things totally different from another. And actually, you know what? I'm going to go to something else before we even go there, because you need to know the difference. You need to know what is holistic midwifery? What is that about? So the book is titled Holistic Midwifery, but let me compare to you what that is. Because you say, okay, it's a little different here at the hospital. They have a certain way they do things. And then I noticed, when I took a tour of a birth center, theirs is a little different, Or when you got to see the virtual tour of the hospital, birth center, birthing area, or the birth center itself, they may have a virtual tour if you're not going to go there. That's how that is. All right, so I'm on page 15 of Holistic Midwifery. Let's talk about what holistic model of a birth would be like for you. All right, so with a midwife is considered a nurturer in a holistic model of a birth. Your home equals a nurturing environment. Mother, baby are inseparable unit, so they're considered an inseparable unit. Connection between growth of baby and state of mother. Baby and mother are considered one. Safety of baby and emotional needs of mother are the same, so they're looking out for both. Good for mother means good for baby. Sufficiency of nature, importance of people. So like if they have the husband around, some other family around, that's what they go by. Family equals essential social unit. Action based on body knowledge and intuition. Experiential and emotional knowledge valued as highly as or more than technical knowledge. Best prenatal care stresses subjective empathy, caring. Health of baby ensured through physical and emotional health of mother and her attunement to the baby. Labor equals a flow of experience. So let's talk about labor. I'm going to go to some information that we have at Fruitful Possession, nonprofit Fruitful Possession.
Jessica Lemazurier has this report from New York.
2 months ago, Shawnee Benton's daughter Shamani died suddenly. Just 30 years old, she died of a pulmonary embolism a fortnight after giving birth to a baby boy.
This is the only picture of them, the entire family together. So a few days before she transitioned, there was a concern about her breathing, and she felt okay the next 2 days. And then she had the emergency situation at the house where they live, and she ended up going into cardiac arrest at the house. And then we know how it ended. Within 12 hours, she was gone.
Shamani was taken by first responders to the local hospital.
The hospital she was in is one of those hospitals that does not get the resources and the funding put into it like other hospitals do. They did a great job with her, but it's in my mind that they didn't have what they needed. It doesn't make sense. she should be here. They, whoever has been taken like this, should be here. Or whoever's been in the hospital and struggled for life. They should be able to walk free and do what they need to do to care for their babies.
If Shamani had been white, would she have survived? That's the question that haunts her family. Because in the US, the rate of maternal mortality is 3 times higher for black women than it is for white. That's according to the Centers for Disease Control and Prevention. And in New York, the situation is even worse. The risk is 8 times higher. Black women of all backgrounds are affected, even those like Shamani, who are well educated and have good healthcare coverage. Medical researchers say the root of the problem is racism.
Racism was baked into the DNA of this country. And since then, every policy has reflected that history, including the myth that black people don't experience pain like white people, which affects people who are going to give birth and are complaining of pain or may have a complication that is not taken as seriously because simply of the color of their skin.
Last year, New York City launched an initiative to reduce maternal deaths among black women. Amongst the measures, more funding for certain hospitals and more training for medical staff to make sure they don't have racial prejudices.
It is some basic information that talks about labor a little bit. All right? So, it says, the 4 stages of labor. Stage 1 has 3 parts. The early stage, the cervix is beginning to open, and it opens at 4 centimeters. The active phase of that, the active stage of labor, is when the cervix opens 4 to 7 centimeters. And the third stage is the transition, where the cervix opens 7 to 10 centimeters. The stage 1 duration, it lasts about 12 to 13 hours. It focuses on thinning, which is known as effacement, and opening, which is called dilation. So effacement and dilation is the focus of that stage of the cervix. Stage 2, the baby's going to move through the birth canal to be born. So the baby's ready to be born, so it's moving its way down through the birth canal to be born. Stage 3, after birth. So the baby at this stage has already been born. Now the placenta is going to be birthed as well. So you actually experience 2 births of something, right? Very important when you go through labor. First, you birth out your new baby boy, your new baby girl. Then you birth out the placenta. When it detaches itself from the uterine wall and comes through the birth canal. Then stage 4 is considered the recovery. So I'm going to share this with you before we go on. It's out of the book of 2nd Esdras in the Apocrypha of the 1611 King James Version Bible. It says, as when a woman with child in the 9th month bringeth forth her son with 2 or 3 hours of her birth, great pains compass her womb, which pains when the child cometh forth, they slack not a moment. But that which keepeth and is kept shall both be preserved, and when the time cometh, the womb preserved delivereth up the things that grew in it. Thou hast commanded out of the parts of the body, that is to say, out of the breast, milk to be given, which is the fruit of the breast. So all praise that. This is another scripture I wanted to share with you about labor. So let's go on to page 15 of the holistic midwifery book. Time is relevant. The flow of the woman's experience is important. So we're going over like a list of what is it like for a holistic model of a birth. Labors can be short or take several days, and this is true. Every pregnancy is unique, and every delivery of a baby is unique. Just consider, it may be your first child, so it may take much longer. You may have had multiple. You may have been pregnant 3 times and birthed out 3 children. Now you're on your 4th child. It could be much shorter. You may be pregnant with twins, for example, right? And that could be longer. Labor can start and stop following its own rhythms. Facilitation, proper food, effective Positioning support is appropriate. Interventions are usually inappropriate. Pain is acceptable. So I'm going to give you something about what's this pain, but I'm going to share this with you. I'm in the book of Ecclesiasticus, chapter 30. All right? I'm just going to share this with you. Verse 21, it says, Give not over thy mind to heaviness, and afflict not thyself in thine own counsel. The gladness of the heart is the life of man, and the joyfulness of a man prolongeth his days. Love thine own soul, and comfort thy heart. Remove sorrow far from thee, for sorrow hath killed many, and there is no profit therein. Envy and wrath shorten the life, and carefulness bringeth age before the time. All right. So let's go on. Page 15, holistic model of birth. It says, mind, body, integration, labor support for pain. So you may have, your husband's going to be there, right? But your husband, you're going to need somebody to help you with labor, because you're going to want your husband to be well rested, well nourished, well hydrated with water, some electrolytes, fluids, things like that. So he can be ready to see the baby come out and cut the umbilical cord, things like that. So you're going to need like a reliable mother, a reliable aunt, a reliable sister, reliable doula, someone like that to come and help you with the labor. Environment is the key to safe birth. Uterus equals responsive part of whole woman. Woman does what she feels is appropriate. VBAC is normal. So in a holistic model of care, a woman who has had a history of a VBAC, which is a vaginal birth after a C-section, she had a baby before, right? But she didn't have a vaginal birth. She had a C-section where she had to go to a hospital to deliver her baby. They had to perform surgery to make an incision to take the baby out. And her babies weren't healthy, but that's what happened. She didn't experience a vaginal birth. That's what a VBAC is. So sometimes when they're pregnant again, they say, okay, I don't want to have my baby in the hospital this time. I want to have it at home. Or I want to have it at a birth center, something small and more private, things like that. So the midwife may say, well, no, you can come to us. I know you had a C-section before, but you having a healthy baby, healthy pregnancy. You're eating healthy. I'm looking at your lab work and everything. You're in great shape. Yes, this is considered normal. So it says VBAC is considered a low-risk pregnancy. It's not considered a high-risk pregnancy. Squatting or hands and knees for breech twins often born by the birth canal. So when you're squatting, the midwife will suggest that you squat or go on all fours if the baby is not in the right position where the baby's head is not facing down. It's okay, the baby's transverse, right? So let's have her go on all fours. Walk around, go back and forth on all fours. Let's do some squatting, things like that. Sit in the birth ball, squatting. And let's move the baby around. Birth equals an activity a woman does that brings new life. Midwife equals skill guide. Let's see. Let me go to the book of Exodus, right? We're talking about midwives. Midwife equals skill guide. So I'm going to share a scripture with you in the book of Exodus. See if I can find that. Okay. So it says, Exodus chapter 1, verses 19. And we're gonna go down a little bit. Exodus chapter 1, verse 19. And the midwives said unto Pharaoh, because the Hebrew women are not as the Egyptian women, for they are lively and are delivered. The midwives come in unto them. So they're being born before they come in, right? Therefore God dealt well with the midwives, and the people multiplied and waxed very mighty. Okay. Let's see. All right, so that's what I wanted to share with you on that. There's actually a couple of verses above that are very good. If you read that, that's you probably would like that even more. But that's a nice example of that. All right, so it says the midwife supports Assist, responsibility is the mother's. All right. So let's talk about the opposite of it. Another approach is called the technocratic model of birth, and this is the process that's normally practiced in a hospital setting. They may have done some changes a little bit, because of COVID-19, but this is usually the model of care. It says a technocratic model of care. I'm on page 15 of that same book. So in a hospital setting, it's a doctor versus a midwife. You may see midwives in the hospital setting, but this is the model of care. They go by this right here. Doctor is considered a technician, like versus a midwife equals a nurturer. So we're going to go over here. Hospital equals a factory. Baby is a product in a technocratic model of birth. So that's what's considered in a hospital setting. Baby grows itself through a mechanical process. Fetus is separate from mother. Safety of fetus pitted against emotional needs of mother. Best interest of mother and fetus antagonistic. Supremacy of technology. Importance of science things. Institution equals significant social unit. Action based on facts and measurements. Only technical knowledge is valued. Best prenatal care is objective, scientific. Health of baby during pregnancy ensured through drugs, tests, and techniques. Labor is a mechanical process. Time is important. Adherence to time charts during labor is essential for safety. Birth must occur within 24 hours. Like we went over the holistic model of care where it says labor can be short or take several days. Labor can start or stop its own rhythms, right? Time is irrelevant in a holistic approach. The flow of a woman's experience is important. So the midwives are used to things going either real long or it could be, short, just normal process. But in a hospital setting, it says birth must occur within 24 hours or they're going to take some action. All right. It says I'm continuing with the technocratic model of birth. It says once labor begins, it should progress steadily. If it doesn't, Pitocin is necessary. So you want to check out the side effects of taking Pitocin. What are the benefits? What are the pros and cons of taking Pitocin? How does that affect the body on the long term? So you want to check that. But like in a home birth setting or midwifery setting, it's different. It's like pain is an acceptable part of labor and delivery, so they don't, use things like that. They don't promote it. Pain is unacceptable. And this is continuing with a technocratic model of birth. Pain is unacceptable, so they want to address that. Analogies, anesthesia for pain during labor. Environment is not relevant. Uterus equals an involuntary muscle. Woman is hooked up to a machine with frequent exams by staff. Once a surgical birth, always a surgical birth for many women. So, for example, like if a husband and wife come in, the baby's about to be born, and then they say, oh no, you can't go through a vaginal birth because you have preeclampsia or you have baby's not moving, things like that. They may say, okay, well, we need to have a C-section. So if you have a C-section, then the next time you come in for the second or third child, they say, oh no, you had a C-section before, you're going to have one again. But with a midwife, with a holistic model of care in a birth center or a home birth, it's normal if you had a history of a VBAC, you can still have a normal pregnancy if there's no other complications. It's not considered high risk. All right, so let's go back to technocratic model of care. Cesarean for breech presentation or twins. All right, so they're going to do a C-section. They're not going to have you go on all fours. They're not going to have you squat, things like that. They're not going to have you squat, things like that. Right? They're going to perform a C-section. So in technocratic model of care, we continue. It says birth. Birth equals a service medicine owns and supplies to society. Obstetrician equals your supervisor. supervisor, manager, skilled technician. So that's what that's considered. But in a holistic approach to a birth, a midwife is a skilled guide. She's a skillful guide. So let's go back to technocratic model of care. It says doctor is in control. But in a holistic model of care, the midwife is working like as an assistant to you. They support. Technocratic model of care. Responsibility begins to the doctor and the system. But in a holistic approach, responsibility is toward the mother. Okay? All right, so let me go back to the initial visit. Let's go back to that initial visit. So, like when you're thinking about for example, a home birth or a water birth. Let's talk about a water birth. If you choose a water birth at home or in a birth center, you'll experience less pain with contractions. It's known for that. Shorter births. Sitting in warm water helps lower blood pressure caused by anxiety. Stress hormones are lowered when sitting in warm water. Lower risk of perineum tears. All right, because a lot of midwives, they will apply grapeseed oil down there, in the perineal area. That's between the anus and the vagina. You take some grapeseed oil, that's a good one, and massage it in there daily. You make sure you do that. That just helps reduce your chance of getting a tear. And then the midwife may do it too. She may take some rags and apply it, some warm water, and then apply it to that area on the day of the labor and delivery, right? So some other benefits of water birth is lower risk of perineal tears in the comforts of your apartment or house. That's another benefit of a water birth. You can control your environment much better. No need to travel, pack your bags, or coming for your birth because you're already home, if you're doing it at home. And then at a birth center, it is much smaller there as well. Okay. So what about if you decide, for example, I want to, I'd really like to have a home birth, when the time comes. What are some of the things I need? I know I need to drink water because water, as far as I'm learning about nutrition and I know, for example, I need to do certain things, but what about a home birth? Okay, so let's talk about some of the things that you need because COVID-19, you'll need more things. More hand sanitizer. You need face masks. You may need some face shields, things like that. You talk it over with your midwife. You may need more cloths, but this is just an example of one. You'll need between 2 to 6 washcloths, between 6 to 12 receiving blankets, bottle of olive oil and chapstick. That's for yourself, right? Because you may get dehydrated. You'll need that. You're pushing, you're in it, it's a while before the baby comes out in most cases, in many cases. Cloth adult diapers, you'll need that as well because after you have your birth, you birth out the baby and then the placenta comes out and detaches from the uterine wall. Just blood coming out from your birthing process. You birthed out you birthed out the baby and the placenta. So, you're going to have to heal. It takes a while. And you can review our circumcision video if you need to learn more about that as well, because it doesn't just talk about circumcision. It talks about what happens, what you should do after you have your baby as well. All right, so let's go on. You need a bottle of olive oil and chapstick, cloth adult diapers. That's for you because you'll be bleeding for a while, different stages after you have your birth. Long cloth sanitation napkins, whether you get the reusable one or you get the disposable ones, or you get a combination of both, you'll need those. A thermometer, a large Chuck's underpads. The thermometer is helpful for so many different things. It helps to, you want a thermometer to regulate, to read the temperature of the water. So you want one that's going to be good to put in water. So if you're sitting in a tub, you'll know if the water's too hot or too cold or it's just right. And you're just going to need one in general, the other type to check for temperature. Large Chuck underpads, that's good for the bed. When you're sitting on the bed, you're birthing out the baby, or you need a lining for the bed as well. nipple cream, newborn caps, newborn baby caps, garbage bags. That's, you'll use garbage bags for soil laundry, and you need one for trash, things like that. You need a flashlight as well, so because you want to dim the lights when the baby's coming. He or she doesn't want to see this really bright light when it come out. You want it to be nice and dark, and you need crock pot, a home birth kit, because a home birth kit has a lot of stuff in there. And then, you discuss it ahead of time. I need to prepare, between 1 and 2 weeks, maybe even 2 weeks, right? Prepared meals for you and your family. You say, okay, I need something for breakfast. I need something for lunch for them. I need something for dinner for them. A snack. Let's see if we can make this stuff up now so we can have a head start. Okay? So I'm going to go on to just some of the things about what's going to happen during your initial visit with a midwife. Well, it just depends on where you go, because a hospital has their process. If you go in a birth center, they have their process. And then if it's a home birth, right, if you're planning a home birth, then there is a process that they go through. And you'll see the differences. You can call all three and talk to all of them and see which ones do you and your Lord really like. And you always want to have a plan B, like, okay, if I have planned on a birth at a birth center, and then now, I want to have it at home. You can discuss it with the midwife. I want to change my mind. I want to discuss it with the midwife. You ask the pricing of it. How much does it cost to have a baby in a birth center? How much does it cost to have a baby at home? Call your insurance company. See, does it cover anything? If I have a baby at home, does anything covered? Are the prenatal visits covered? Or postpartum visits covered? Is labor and delivery covered? Anything covered? Or is it with this particular provider you're going to? You want to get the midwife's provider number, things like that. Just check all things out. Find out ahead of time. Is this covered? Even if you're not expecting a child, if you just got married, right? You can start calling around now and say, what is your process for this, considering the circumstances, and call your insurance company, right? See if it's covered, with this provider, just in case down the road you're thinking about going to this midwife. If you have a baby, how much it costs at home, how much it costs at the birth center, and so on. All right, let's go to page 549. The initial visit and medical history. The visit. This is the visit which follows the consultation, because that will happen a lot of times. You may have a consultation with a midwife virtually, by phone, by the internet, using, some sort of virtual service. It says the visit which follows the consultation will usually include a general review of the medical history and a physical exam. So it may be a combination. They may meet with you and then they do part of it online. Some prefer to have a woman fill out a form at home, then bring it in for discussion in this way. She has thought about each question and may have more to offer when the interview rolls around. So some information, the midwife may talk to you virtually by internet, and she might say, okay, I received your information. This is the consultation. You don't have to come in for this one. I don't have to come over there. Let's talk about, certain things. And it says, and that'll be free. The consultations are usually free, but you want to check with them as well on that, confirm that. It says, however, a woman will not understand a question's purpose and either answer it inappropriately or not at all. Many clinicians have clients fill out forms in a waiting room. To some women, this can seem impersonal, so that might be in a hospital setting. Other midwives ask the woman each question in person and fill in the form themselves. Not only does the midwife engage with the woman in documenting the information, the midwife can determine if the woman understands each question and can probe for more information if significant facts are brought to light during the interview. Okay? It says still other midwives will have a woman fill out her form and then ask every question again during an interview process. All right, so you may fill out some forms, some reference material, things like that. They make sure they listen carefully, things like that. And they may ask something like this. they might ask, it says, we will review the rationale for each question using the forms included as examples at the end of this. So it says, it might say date of initial history. You might see that on there. Your due date, your last known menstrual period, that's probably on the form. Your blood type and the RH factor. It says, again, this is pertinent information that needs to be readily accessible in more than one location. You're going to put your name, the mother's name, the age, the birth date, and occupation up there. Your address, your telephone number, right? The father's name, the age, the birth date, and his occupation, right? And you're going to ask, like, have you had any prenatal care before coming to me? They want to know things like that. Do you plan to breastfeed your child, right? So I'm going to read that, right? So it says, do you plan to breastfeed? So, of course, Most High wants us to, if we have children, breastfeed our children. So I'm going to go over something with you from Fruitful Possession, but it's actually from the Bible. But, Most High says this, all praises. So it says, I'm going to read this to you. 2 Ezra chapter 8, verse 11. That's in the Apocrypha. In the 1611 King James Version Bible, it says, that the thing which is fashioned may be nourished for a time, till thou depositest it to thy mercy. Right? And Ecclesiasticus 39, 26 to 27. The principal things for the whole use of man's life are water, fire, iron, and salt, flour of wheat, honey, milk, and the blood of the grape, and oil, and clothing. All these things are of good to the godly. So to the sinners they are turned into evil. So it's really good to know that. It says benefits of breastfeeding. So you're going to have a stronger bond with your baby, reduced risk of SIDS, which is sudden infant death syndrome, if you breastfeed, reduced risk of type 1 diabetes in your child, less ear infections that you have to deal with your child. You don't have to keep calling the doctor. It says lower risk of breast and other cancers for mom, stronger bones. Moms have 50% reduction in rheumatoid arthritis, can feed baby on demand, so you can feed him right on demand, him or her right on demand. Less dental cavities for a child. Stronger immune system for a child. Boys grow up to be healthier dads and can live longer, which means they can help build communities. They'll be grandpas longer, great-great-grandpas, great-great-uncles, you know what I mean? Things like that. And then coverings for breastfeeding. 1 Timothy 2 and 9, so you want to have a breastfeeding cover. In like manner also, that women adorn themselves in modest apparel, with shamefaced and sobriety, not with broidered hair or gold or pearls or costly array, but which becometh women professing godliness with good works. So I'm going to just go on to that. So that's 1 Timothy 2, 1 Timothy chapter 2, 9, verses 9 through 15. So I just want to check to make sure I was covering the whole scriptures for you. And let's read that again. 1 Timothy chapter 2, verses 9 to 15. In like manner also, that women adorn themselves in modest apparel, with shamefaced and sobriety, not with broidered hair or gold or pearls or costly array, but which becometh women professing godliness with good works. Let the woman learn in silence with all subjection, but I suffer not a woman to teach, nor to assert authority over the man, but to be in silence. For Adam was first formed, then Eve, and Adam was not deceived, but the woman being deceived was in the transgression. Notwithstanding, she shall be saved in childbearing, if they continue in faith and charity and holiness with sobriety. So that's just, all praise the Most High for that. All praise it. That's just something, I wanted to share with you that I learned, and it's very helpful, along with Titus 2, 3 through 5 and other scriptures. All right? So let's go back on to the initial visit. So when you're filling out the form, they're gonna say, okay, have you had any prior pregnancies? So they'll go over. They'll ask you how many. Was it a total? How many births did you have altogether? How many pregnancies did you have altogether? Are they alive? Did you have any stillbirths, abortions, miscarriages? They're gonna ask things like that in detail. They're gonna ask you when, how old are your children, things like that. How long were you pregnant with each one? So I'll say weeks, gestation, pregnancy at birth. What type of birth was it? For example, was it a vaginal birth? Was it a C-section? What was the total weight gain of that pregnancy that you had? Prenatal problem. Do you have any prenatal problems? What's your early labor history? Active labor, right? They want to know what was your experience of the birth? Did you have any complications? What was the baby's position at birth? Things like that. How much did your baby weigh? Did you have any problems with that baby? What was your postpartum experience? And how's your child's health now? From the amount of births that you had, do you have healthy children? Do they have any learning disabilities, things like that? They're going to ask about any complications. Were you ever on any contraceptives at that time in the past? They're going to ask you things like that. They're going to ask you, how old were you when you had your first menstrual cycle? Are they regular? What's the average length of your menstrual cycle? What is your usual amount of flow? Is it heavy, very heavy? So you want to go over that. If you can, you want to go over that circumcision video from Fruitful Possession. It goes over areas like this as well with the Bible about your cycles, as well as circumcising your son. Did you have any problems with your cycles? It's going to go over that with you. Let's see. They're going to go over your due date. She's going to calculate the due date with you. She's going to also ask you, well, how long, where were you born? Were you born in a house? Were you born in a hospital? How much did you weigh when you were born? Did your mom have you vaginally, or was it a C-section? Were you a twin? Were you the first child, second child, things like that? They're going to ask about your father's history, your information, your health history with your father. They're going to ask you, did you smoke in the past? Are you smoking now? Because, even though you're not supposed to do that in truth, they're going to ask you that as well. Let's see. What are some other things? They want to know if you're on any kind of medication, things like that.
We see it way too much that African American women, poor women, and women of color do not get the same level of care as white women in America.
Founder of Me Bella Wellness Center in Birmingham, Dr. Mia Cowan issues a word of caution after well-known pediatric chief resident Shanice Wallace died of a pregnancy complication known as preeclampsia.
Preeclampsia is a hypertensive disease in pregnancy.
Cowan says the disease can cause high blood pressure, seizures, headaches, and swelling in the face and hands.
It can't necessarily be prevented. However, if it's detected early and treated properly, the outcome can still be good.
Cowan says the disease affects Black women at a disproportionate rate than white women.
I think it's racial bias in the healthcare system. I mean, I see it all day, every day. I have the privilege of taking care of all kinds of patients, Black, white, brown, poor, and rich. And the patients who I notice that get different care are usually African American patients or poor patients.
Dr. Wallace died suddenly after successfully delivering her 35-week-old baby girl. Dr. Cowan says the only way to combat these types of complications is
getting doctors that they trust, that they know actually care about them, and give them the best care regardless of race or socioeconomic status.
Dr. Cowan says women experiencing any symptoms should contact their healthcare provider immediately. In Birmingham, Xavier Harris, WVTM 13.
Were you exposed to anything like radiation? Do you use microwaves all the time? Do you get exercise? Are you drinking a lot of sugary food, beverages? Are you avoiding things like corn syrup? Things like that. Are you using a lot of salt? Are you using a lot of caffeine? What kind of diet do you have? Are you eating like green leafy vegetables? You making sure you get your iron in there? Are you eating a lot of candy? They want to, she want to make sure you're checking. Are you eating like the right amount? We're going to go over that too as well. Do you have any pets? Like, do you have any cats, dogs, birds, goldfish, things like that? Medical history. So they're going to want to know, about your blood pressure. Are you anemic? Do you have diabetes or a thyroid disorder, respiratory disease of any kind, right? Things like that. Central nervous disorders, right? Because sometimes, I'll give you an example. Sometimes with anemia, it could be hereditary or it could be a nutritional deficiency. So, you'd be surprised. It says, and I'm on page 565 of this same book, and I'm going to read this to you. It says, have the pregnant woman, biological father, or any immediate relatives had any of these health problems? That's what they're going to ask you on the forms, or she's going to ask you while she's going over the forms. So, for example, anemia, that's a common thing in the Israelite community. And that can cause problems during pregnancy if it's not addressed appropriately. So it says, anemia, blood disorders. They're going to ask things like this. Any hereditary anemias? Has she ever bled excessively or clotted abnormally? So you might notice things like that. And you may not realize, I may have anemia. Any bleeding problems during surgery, dental work, or with an injury? Like if you just cut your hand a little, are you bleeding all the time and it's hard to stop? Any babies with clotting or bleeding problems in either family? What treatments have been used to correct any problems? Have the problems reoccurred? Women from specific ethnic or racial backgrounds should be made aware of screening programs for hereditary anemias. All right, just hereditary. We're not talking about the one that is not. When I say hereditary anemia, I mean like sickle cell anemia. That's like a hereditary one. But there's another form of anemia it's common. It's caused by poor diet, poor nutritional habits. Right? So diabetes, a history of diabetes, they'll ask you things like that. Thyroid disorders, any problems with growth or development in the family, weight problems, respiratory disease. This includes TB, asthma. TB is tuberculosis, asthma, pneumonia, or bronchitis, especially if chronic, and other respiratory problems as well. Like, they'll just ask you things like that. Convulsive, central nervous system disorders. Convulsions may be caused by epilepsy, things like that. But it's not always the causative factor, so it may not always be the reason why that's happening. These are things that's going to happen to you during that initial visit because they want to get like a really nice profile on you to make sure they give you the best care. They want to know if you have cancer, right? Because sometimes women are pregnant and they have cancer. Varicose veins, genetic disorders, right? Like Down syndrome, things like that. Are there any relatives with Down syndrome? That's what they're going to ask you, things like that. Then they're going to ask, okay, has the pregnant woman or biological father or current, has a pregnant woman or biological father been exposed to any of these things? I'm going to list you these things that you're going to hear on the form. They want to know if you had steroid therapy, anybody, you or the father of the child, says the husband. Genital herpes. So they want to know if you or your husband have been exposed to this. They're gonna ask you these things in the chart. So these are normal things they're gonna ask. Genital herpes. Has either ever had genital herpes? Because they're gonna need to know about things like that. So if you're planning on having a vaginal birth, things have to be, prepared properly. Genital warts. Have you ever had any of those? Gonorrhea. They're gonna want to know. Have you ever had gonorrhea? They're going to ask these things. Syphilis. They're going to ask that. HIV. Excessive amounts of x-rays and ultrasounds. So they just kept giving you x-rays over x-rays over x-rays, over and over again. They want to know. Okay. And they want to know if you ever had anorexia or bulimia, some sort of eating disorder. They need to know about things like that because they want to be able to remember, the midwife is there as an assistant, as a support person. So they want to make sure that they are monitoring you to make sure you have a healthy pregnancy. So they want to see if you have an eating disorder as well, if you're overeating too much, or you are not eating enough, and things like that. You're not stabilizing with your weight, whether too much or too little. If you ever had any kind of severe illness before, stomach or gastrointestinal problems, severe headaches, allergies, general surgery, things like that. You ever had any back problems or arthritis? These are really important things to know. They want to know if you ever had any UTIs, urinary tract infections, for example, as well as they're gonna blood type you. So I'm gonna read this to you. This is very important. I'm on page 571. So this is about the blood. You will hear about this. It says blood type factor. If the father and mother are Rh negative, now you're gonna hear this because sometimes this happens. If the father and mother are both Rh negative, then Rh sensitization is almost impossible. About 1 in 100,000 babies will have a genetic mutation leading to Rh positive blood. You can explain this to the parents so they can choose whether they want routine antibody screens during pregnancy. Remember that if a woman has been previously sensitized to a minor blood factor and the father is positive for that factor, the baby could also be positive, and the possibility of a blood incompatibility problem would then exist. Therefore, if the mother knows herself to have been sensitized via a previous transfusion or pregnancy, the first step is to get the blood type of the father to determine if he is positive for the factor. All right. So in this particular case, you have to really be careful with this, because if it's not addressed when the mother is pregnant, her body can actually attack the fetus and think it's a foreign invader and attack the pregnancy. So you want to make sure you definitely focus on this, the blood typing of Rh negative, and concentrating on that. All right, so let's see. They're going to ask you all kinds of things: relationship to mother, health problems. What do you know about? It says, what do they know about their own birth or the birth of siblings? So the midwife is going to ask you, how were you born? Were you born vaginally, as we discussed earlier? And was it a healthy pregnancy with your mom? Did she get sick all the time? Because that helps decide what you will experience when you are pregnant. Even though every pregnancy is unique, some things really help out. For example, you can collect that information. What is the psychological factor? All right, it'll ask you that as well. It says, in some ways, the entire initial exam is a psychological profile, in that you are observing how the woman responds to your questions and how forthcoming she is with details, emotional experiences, and the like. And this is on page 571 of this book, Anne Fry. And you remember the scriptures like Sirach chapter 30 that discuss about giving that mind over to heaviness. And then you have support, of course, from your family. The scriptures as well as keeping yourself busy, having a lot of activities, exercising, meditating on scriptures, doing hobbies that you love, being around family, in the truth or praises, things like that. All right, so it's gonna just things like that. They're gonna ask you a lot of different things. All right, so I'm gonna go on to vitamins and minerals now. So I gave it a basic idea of what a prenatal exam is like, right? So and what kind of questions they'll ask, and during that first visit, they're gonna be focusing on your weight, your nutrition, your vitamins, your immunizations, if you choose to do that, right? And how often you're going to go to the midwife, all right? Typically I'm back in this book again. And so in this book, I'm going to close out. It just says that on page 4, it says, typically in a pregnancy with no complications or special concerns, you will have healthcare appointments once a month until late pregnancy, twice a month during your 7th or 8th month, and every week after that until delivery. All right? So, and then at these visits, your healthcare professional will check your weight, your blood pressure, and urine. And they're going to palpate the baby too. Your abdomen will be measured periodically to see how much your baby has grown. Pelvic exams and blood work are not usually done at every visit. So that's just like a recap of, what a basic prenatal exam is like, So let's go on to nutrition. So I'm in that same book, Prenatal Care, but we're going to go on to nutrition now. Now I'm on page 6. So it says nutrition during pregnancy, eating for 2. So if you're expecting 1 baby, this is what this is for. It says nutrition is important before, during, and after pregnancy. All the nutrients your baby needs while in the womb come from you and the food you choose. And of course, you want to take some really good prenatal vitamins. You want to drink plenty of water. So I'm going to go on to the water part. So I'm going to go back to some fruitful possession information. But you can easily look this up on your own, right? On the internet. And let's look up why is it, some of the things of why it's important to drink water. Like we know about great benefits of some teas that we learned about, like organic alfalfa leaf, right? So it says organic alfalfa leaf is a lawful tea high in vitamin K. We're going to go over some vitamins in a little while. Vitamin K, and contains a hormone called phytoestrogen. It's known for its use in treating menstrual and menopausal symptoms. Not only is it good for bleeding disorders like anemia, it can also assist with lowering cholesterol, diabetes, digestive upset, and arthritic symptoms. Alfalfa can be taken in organic pill form or naturally, which is always best, as alfalfa leaf tea 2 to 3 times a day. This can be purchased at your local supermarket, grown in your garden or in a pot, or purchased online. Organic red raspberry leaf tea is a lawful herb with levels of vitamin C, A and B complex, iron, vitamin E, and some calcium for the Israelite family. It has been used for centuries to address morning sickness by relieving nausea and toning the uterus to prevent miscarriages in the first trimester. Some other benefits include the reduction of labor pain and assists in the release of the placenta. Drinking the tea before labor begins can ease the intensity of the pain and shorten the active labor stages for many. But of course, every pregnancy is unique. So, of course, that could be grown as well, in your yard. You can purchase it online, things like that. But it's best to drink it. You can drink it hot or cold. You can even add it to your cranberry juice, things like that. And so you want to also, consult with your midwife first, because many midwives may say, I don't want you to take the raspberry leaf tea until maybe like the 3rd trimester because it works as a uterine tonic. It's getting your body ready, right? So it might say, it might make you go into labor sooner. So it just depends. It's not dangerous to take it. It's just that your midwife may say, no, just wait until the 3rd trimester with this particular tea, the red raspberry tea, because it's a uterine tonic. It's going to help you during that labor process. So she might say, okay, I want you to just concentrate on nutrition, your health, exercise, eating healthy, doing some aqua aerobics, in pregnancy. That's good for you. That's like a lower level exercise, right? It helps to relieve like body aches. That's what aqua aerobics does. You may want you to do something, like that as well. she doesn't want you to take it too soon. Let's just say that. Okay, so let's go on to some benefits of water before we get started with the nutrition in detail. This is actually part of nutrition. Water is part of nutrition because you are putting it in your body. It's a fluid, right? It helps to get rid of waste through urination and perspiration and your bowel movements, because a lot of pregnant women will have constipation. And it may not be that they don't have enough fiber in their diet, right? Or they were taking, they just didn't have enough fiber in their diet. They didn't have enough water to move it. So water helps to get rid of waste through urination, perspiration, and bowel movements. It helps to keep your temperature in control. It lubricates and cushions your joints. It protects sensitive tissues. It keeps your skin clear. Like for example, it helps with your blood circulation as well. All kind of things. Your muscles, your joints, everything needs that. Your hair. And when you take multivitamins, and your body needs water to travel through your system to get to where it's got to go. All right, so let's go on to nutrition. So now I'm going to go to 204, I believe. 250. I'm going to go to 204 first. Of the same book, the Anne Fry book. So we're going to need to go over some basic things first. So when I go over the very short areas of what a vitamin and mineral is, you'll kind of, understand why we had to go over it. So I'm on page 204, and this is basic nutrition. So we always hear about vitamins and minerals. Oh yeah, make sure you take your multivitamin, and make sure you take your prenatal vitamins, and it's really good for this. You may hear about folic acid, vitamin K, iron, but let's just learn a little bit of basics of why we need to have it and why we need to eat it in like a natural form versus trying to get it in pills all the time, because our body doesn't process things the same way. All right, I'm on page 204, Basic Nutrition of the Anne Fry book called Holistic Midwifery. It says, the importance of nutrition during pregnancy. So even though we're talking about the importance of nutrition during pregnancy, your husbands, right? By your example, letting your light shine, eating healthy for the family, you cooking for the family in a healthy way, right? Like getting brown sugar or cane sugar over white sugar, or using honey in replacement of sugar in general, using sea salt or Himalayan salt versus the table salt, using extra virgin olive oil, for example, versus Crisco oil or a lot of heavy butter, using like low-fat milk versus the full blend milk, right? Or using egg whites much more often than using eggs with the yolk in it all the time, eating more fish, like salmon and cod and flounder and tuna. And when you're cooking with chicken, take the skin off. You can even eat it boneless if you like, things like that. You can have some nice vegetation, vegan meals as well. You can have, things like that. So, that would be a good example. And then when you're eating healthy for yourself, your husband's eating healthy, your growing baby's eating healthy, and any other children you eat healthy. And when you're cooking in general, you're just being a great example. Like in Titus 2 and Proverbs 31 and so on. All right, so it says on page 204, the importance of nutrition during pregnancy. Adequate nutrition is the single most important physical factor in determining the outcome of pregnancy. Did you hear that? It says the importance of nutrition during pregnancy. So if this is important in pregnancy, imagine if it's done in your household as well. It says adequate nutrition is the single most important physical factor in determining the outcome of pregnancy. Good nutrition can make up for a multitude of problems and deficiencies in other areas of a pregnant woman's life. For example, I'll give you a basic one. If you are overweight and you are pregnant and you weren't eating healthy, and then you say, you know what, I got to change because I have to eat healthier now, right? You are making a significant difference. Don't think it's too late to not eat healthier. You can. Or you could be older and you got pregnant and you weren't eating quite as well. Now you change your eating habits. That's a positive thing. Or if you are in great shape, like you're the ideal weight, you don't have any high blood pressure, you don't have anything, you're not gaining a lot of weight during your pregnancy, but you're not eating quite as healthy as you could. You're fit as a fiddle as far as like you don't have any medical problems, but you want to eat even healthier than what you are. You might be eating lawful things like in Leviticus chapter 11 of the King James 1611 King James Version Bible. But you say, okay, I cook really well. Nobody's sick in the family, but I'm gonna start eating healthier now because I didn't know I wasn't having enough of, for example, vitamin K, or you didn't have enough iron. You didn't know these things because you probably hear in the news that a lot of sisters, in Israel, they may be educated on, pregnancy. They may have had money, or they didn't have money, but they know all about their pregnancy and everything, their health care. They had everything planned out, and things didn't go well with their pregnancy.
We see it way too much that African American women, poor women, and women of color do not get the same level of care as white women in America.
Founder of Me Bella Wellness Center in Birmingham, Dr. Mia Cowan issues a word of caution after well-known pediatric chief resident Shanice Wallace died of a pregnancy complication known as preeclampsia.
Preeclampsia is a hypertensive disease in pregnancy.
Cowan says the disease can cause high blood pressure, seizures, headaches, and swelling in the face and hands.
It can't necessarily be prevented. However, if it's detected early and treated properly, the outcome can still be good.
Cowan says the disease affects Black women at a disproportionate rate than white women.
I think it's racial bias in the healthcare system. I mean, I see it all day, every day. I have the privilege of taking care of all kinds of patients, Black, white, brown, poor, and rich. And the patients who I notice that get different care are usually African American patients or poor patients.
Dr. Wallace died suddenly after successfully delivering her 35-week-old baby girl. Dr. Cowan says the only way to combat these types of complications is
getting doctors that they trust, that they know actually care about them, and give them the best care regardless of race or socioeconomic status.
Dr. Cowan says women experiencing any symptoms should contact their healthcare provider immediately. In Birmingham, Xavier Harris, WVTM 13.
Because we have a high infant mortality and high maternal mortality rates, morbidity rates. So you'll hear about that in the news. But if you change your eating habits, it makes a significant difference, no matter what your circumstance. And of course, it has to do with the Most High. It says, good nutrition can make up for a multitude of problems and deficiencies in other areas of a pregnant woman's life. When a woman's work environment is stressful, when she has closely spaced pregnancies, or when she has health-compromising medical conditions, good nutrition and adequate amounts of a variety of foods will provide the necessary cushion of protection both mother and developing baby need to make it through birth with a minimum of problems. What constitutes an adequate diet during pregnancy includes increased amounts of protein, salt, but you want to have the good type of salt, like sea salt and Himalayan salt, and you don't want to have too much of that. So you want to check into the amount that it's good for your body. And calories and other nutrients over and above what a non-pregnant woman needs due to the physiological changes that take place to support the pregnancy. Proper nourishment is protective because it allows the blood volume to expand adequately, preventing toxemia and bringing mother and baby to labor with a maximum reserves for withstanding the stress of birth. So that makes a huge difference. Now I'm going to go on to page 205. I'm going to focus on just a few of the paragraphs and go on to the list of vitamins and minerals. It says, a whole foods diet consists of as much unprocessed food in its natural form as possible. This means whole grain flour and bread, products, no white enriched flour, natural cheeses rather than cheese foods or other processed products, real eggs and not egg substitutes. The typical American diet is the most processed and denatured diet in the world. It can be a simple matter to direct women to whatever traditional or ethnic diets they may also be familiar with. If American foods are all they know, a transition from processed to whole food equivalents of those foods they like is appropriate. And then it goes on to say there are basically 5 kinds of nutritive substances found in food. So whenever you're eating foods, when you're going food shopping, you're ordering online, you just need to know some basic things so you just know the categories. We may see in the store produce section, dairy section, meat section, things like that. But we just would need to know some basic things like there are basically 5 kinds of nutritive substances found in foods. Because remember, it says in the first sentence on page 204, it says the importance of nutrition during pregnancy. So every time you see a pregnant woman, this is what is really good to know. And we have a high infant mortality rate, we have a high maternal mortality rate, morbidity rate. So it says the importance of nutrition during pregnancy. Adequate nutrition is the single most important physical factor in determining the outcome of pregnancy. So it determines if you're going to have a stillbirth, if you're going to have a C-section, if there's going to be a high infant mortality rate or high morbidity rate, maternal mortality rate, and of course overall is, because of the Most High, whatever the Most High decides. But this is something that we can learn. All right, so it says there are basically 5 kinds of nutritive substances found in foods: proteins, fats, carbohydrates, vitamins, and minerals. So those are the 5 types: proteins, fish, carbohydrates, vitamins, and minerals. Proteins, fats, and carbohydrates are discussed in another area, but it says vitamins are organic nutrients. So vitamins are organic nutrients required in tiny amounts to maintain growth and normal metabolism. This is very important. Minerals are inorganic substances which may appear in combination with each other or with organic compounds which are required for a physiological process. Vitamins function with chemicals called enzymes, which have numerous essential functions within the body. Enzymes have 2 parts to them. So a protein molecule and a coenzyme, which is often a vitamin or something made from a vitamin. So enzymes are responsible for the delivery of nutrients to the cells and elimination of waste from the cells. They also play a major role in growth, metabolism, cellular reproduction, and digestion. Like, you eat something and you need it to digest your food, you need your enzymes for that. For example, if someone is lactose intolerant and they don't know they're lactose intolerant, they could experience like abdominal cramping, bloating, constipation after a while, inflammation, diarrhea, because they don't have the enzyme in the body to digest that naturally. So they have to drink something like lactate milk or just avoid it. They have to get like almond milk, things like that. Now it says, all right, so it says minerals exist in the body in inorganic and organic form. So minerals exist in the body in organic and inorganic combinations. They act as catalysts for many biological reactions such as muscle response, like contractions of muscles. Imagine having a deficiency in that during labor and delivery. So you want to make sure that works well. Neurological transmissions, digestion, and the nutrition of nutrients from food. So you don't want to have a deficiency in this area, because if you're expecting a baby, you're carrying a baby, you don't want to have even more additional discomforts in your body. You can significantly reduce that by having the right amount of vitamins and minerals, really good nutrition. All right, so it says neurological transmissions, digestion, and the utilization of nutrients from foods. They are important in the production of hormones. They also help to maintain fluid balance and normal pH within the body. Minerals and vitamins coexist and work together. All right, so now I'm just going to go on to a list of some important vitamins and minerals, especially in pregnancy, but it helps us all in some capacity. So let's see. Let me go over. I want to go over protein, for example. Protein is necessary for growth and development, formation of hormones, enzymes, and antibodies, maintains acid-alkali balance, source of heat and energy. But if you have a deficiency in this area, you don't have enough protein, you could experience fatigue, loss of appetite, diarrhea and vomiting, stunted growth, and edema. Vitamin B deficiencies. Vitamin B vitamins. Necessary for carbohydrates, fat, and protein metabolism, aids nervous system functions, helps maintain muscle tone in gastrointestinal tract, that's the stomach and the intestines, your colon. Maintains health of hair, eyes, mouth, and liver. If you have a deficiency in vitamin B, dry, rough, cracked skin, acne, dull, dry or gray hair, fatigue, poor appetite, gastrointestinal tract disorders. So it could cause acne just by having a vitamin B deficiency. So if you have a lot of acne, you might want to check your B levels. Vitamin B1, here's another one. There's several different vitamin B vitamins. So here's one called thiamine, vitamin B1. Is necessary for carbohydrate metabolism, helps maintain healthy nervous system, stabilizes your appetite, stimulates growth and good muscle tone. But it says a deficiency in a vitamin B1 is gastrointestinal disorders, fatigue, loss of appetite, nerve and heart disorders. If it's severe, can cause beriberi in newborns. That's beriberi. That's a disorder in newborns. Vitamin B2, the importance of this is necessary for carbohydrate, fat, and protein metabolism, aids in formation of red blood cells and antibodies, which help to fight infections, maintains cell respiration. A deficiency is eye problems, cracks and sores in mouth, dermatitis, retarded growth, digestive disturbance. If severe in late pregnancy, may be associated with prematurity or stillbirth. So someone may have had a baby and they say, oh, the baby was born stillbirth. They could find it was just all about, they might give you a reason, okay, this happened to the lungs and all this stuff and it's a stillbirth, but you want to make sure you watch out for your B levels. You want to have those prenatal vitamins in there, and you definitely want to eat a very good source of nutrients. And those nutrients are, we want to have even distributions of these. I'm going to read that back to you. We mentioned that. Proteins, fats, carbohydrates, vitamins, and minerals. These are basically 5 kinds of nutritive substances found in foods. You want to make sure you have foods that are adequate in those things. Very important to you. Because you don't want to experience anything you don't have to if you are able to get the appropriate nutrition. All right, let me go on to another one. Vitamin B12. What is it? What is its importance in the body? It's essential for normal cell formation, necessary for carbohydrate, fat, and protein metabolism, maintains healthy nervous system. But what can happen? Deficiencies can cause pernicious anemia, brain damage, nervousness, and neuritis. Vitamin C, we hear about that a lot, right? Vitamin C maintains collagen, helps heal wounds and fractures, strengthens blood vessels, helps resist infections, aids iron absorption, stimulates T effector cell activity, reduces lipid production in the brain. But if there's inadequate amounts of vitamin C, you may experience bleeding gums, swollen or painful joints, slow healing wounds and fractures, bruising, nosebleeds, impaired digestion. Vitamin D. If you're able to look up information about vitamin D, there's a lot of roles vitamin D plays in. And there's even like articles about how if you eat a lot of foods and it has corn syrup in there, it can interfere with the absorption and the role of what vitamin D is supposed to play in your body. So you really want to look up articles like vitamin D and corn syrup and how does that work. That's like a good example to review. You know, when you're pregnant, you can read things like that, or if you're not pregnant, you want to read about that because corn syrup can definitely affect that. So vitamin D. It improves absorption and utilization of calcium and phosphorus required for bone formation, maintains stable nervous system, and normal heart action. But if a deficiency in vitamin D is to poor bone and tooth formation, softening of bones and teeth, inadequate absorption of calcium, retention of phosphorus in kidneys, possibly fetal malformation, face, heart, and skull. So if there is an inadequate amount of vitamin D, poor bone and tooth formation, softening of bones and teeth, inadequate absorption of calcium, retention of phosphorus in kidneys, possibly fetal malformation of face, feet, heart, and skull. All right. So you want to make sure you're taking your adequate amounts of vitamin D3. You know, you can get that from the sun, but a lot of times, a lot of people aren't out in the sun as often as they realize. They may, go out and do a few activities. But like, for example, during the winter, they say most people are only exposed to the sun, especially in a certain region, on the earth, about 7.4%. It's less than 8%, So you can get vitamin D from the sun, and you can also get it from a supplement. And you want to check based on what you need for your body, how much you should have. All right, so vitamin K. Here's another one. Vitamin K is necessary for formation of prothrombin. It is needed for blood coagulation, so definitely needed for clotting. What is a deficiency? The deficiency with vitamin K is low prothrombin levels, tendency to bleed and bruise easily. If you take a synthetic form of vitamin K, it can be toxic to the body. Injection in newborns has been linked to childhood cancers. So it says vitamin K. If you get vitamin K injections in a newborn, I'm on page, let's see. I'm reading pages 206 and 207 in Anne Fry, and it says, synthetic vitamin K may be toxic. So injection in newborns has been linked to childhood cancer. So when you hear about that, it's, do we want vitamin K shots in a newborn? That's what can happen. Now let's go on to zinc, because that's something that we have to focus on, because it says nutrition during pregnancy, eating for two. I'm back in the prenatal care book. It says your new nutritional needs will be calories, protein, calcium, iron, folate, and B vitamins, zinc, and fluids. So I'm going to go on to zinc now. And it says zinc is important. It says component of insulin and male reproductive seminal fluid, aids digestion and metabolism of phosphorus, aids wound healing. So it's very important. So it helps your husband as well. Male reproductive seminal fluid. That's what it's important for. That's what the zinc role is for. Component of insulin and male reproductive seminal fluid aids digestion and metabolism of phosphorus, aids wound healing. But if there is a lack of zinc, it says retarded growth of the baby, delayed sexual maturity, prolonged wound healing, stretch marks. You get stretch marks from zinc deficiencies, irregular menses, those are your menstrual cycles, diabetes, loss of taste and appetite, central nervous system damage in the fetus. All right. All right, so let's make sure I went over iron, folic acid. I want to make sure I went over that. So we went over some vitamins and minerals. All right, let me go over folic acid. That is very, very important. So folic acid is considered a nutrient. All right, it's a nutrient. And it says, it's used in red blood cell formation, aids metabolism of proteins necessary for growth and division of body cells. But if there's a deficiency in folic acid, if there's poor growth, gastrointestinal disorders, anemia, poor memory, neural tube defects in the fetus, possibly small babies. So that's the role of folic acid. And there's one more I like to go over with you. It's called iron. So iron is considered a mineral, as like zinc. Zinc is a mineral, and iron is also a mineral. So it says, the importance of iron is necessary for hemoglobin and myoglobin formation. It helps in protein metabolism and promotes growth. If there is a deficiency in iron, there's weakness, paleness of skin, constipation, and anemia. So if you take iron in a synthetic form, which is like a pill, there is a chance of excessive intake may be toxic to the body. All right. So what are some food sources for some of these things? Let's talk about that. So I'm on page 210 and 211 right now in the same book of Anne Fry. And it's going over, I'm going to just read the first line or two. It says, there is a group of vitamins, minerals, and enzymes called antioxidants. You're going to hear about that in your life. Antioxidants that help protect our body from formation of free radicals. So antioxidants help free our bodies of, help to clear our body of free radicals. So it protects us. Free radicals are atoms or groups of atoms that can cause damage to cells, impair immune function, and lead to infectious and degenerative disease. All right. So let's see. What are some food sources where we can get these antioxidants? So we need these things. Remember, it says there is a group of vitamins, minerals, and enzymes that are known. They're known as antioxidants that help protect our body from formation of free radicals. What are these free radicals? Free radicals are atoms or groups of atoms that can cause damage to cells, impair immune function, which help to fight all infections for us, a lot of infections for us, and lead to infectious and degenerative diseases. So you can get this protection in the foods that you select. So, for example, you can get antioxidants in using vegetable oil, evening primrose oil, blackcurrant seed oil, borage oil, protein-rich foods, barley grass, broccoli, Brussels sprouts, cabbage, wheatgrass, and most green plants. You can get it in salmon and sardines. All right, you get it in the lawful foods. You pick it in the lawful foods. All right, so where can you get like good sources of carbohydrates, like the good ones? All right, so I'm on page 211, and it says, if you want to get carbohydrates, select it from whole grains, right? You can get it from sweeteners, like cane sugar, dark brown sugar, right? Manuka honey, fruits and vegetables, especially starchy and root. You can get, you need fats in your diet. We need fats as well. You can get that from butter, vegetable oils. You get your extra virgin olive oil, meat, fats, like boneless chicken, milk products, nuts and seeds like almonds or walnuts or pecans, things like that, or pumpkin seeds or sunflower seeds. Protein is from meats, fish like salmon and cod, flounder, things like that, tuna, poultry, soy, eggs, milk products, whole grains, and beans like kidney beans and black beans and lima beans, things like that. You're going to need water. You're going to need to drink a significant amount of water, and you drink water based on what the doctor or midwife says is good for your body size, in your pregnancy. Even before you get pregnant, you should be drinking water. You can use like a Berkey, like if you want to have your own water. There's we're not affiliated with any other organization, and we're not promoting any items, things like that, but this is just for educational purposes only. So there are different ways you can get like a water filtration unit, something like that in your house, or a pitcher that has a filtration unit, drink healthy water. You can get water also through fruits and vegetables like honeydew and watermelon and grapes, things like that, for example. Vitamin A, you're going to need vitamin A. You can get that through eggs, liver, eggs, yellow fruits and vegetables, dark green fruits and vegetables, dairy products. Your vitamin Bs, you can get them from whole grains, brown rice. You can get it from fish, poultry, the same thing, legumes and nuts, for example. Tuna. So you can get a lot of these vitamins and minerals and antioxidants from your food. Folic acid. Now that's very important to a couple that's planning on having children or they are pregnant. Folic acid, you can get in dark green leafy vegetables like kale or spinach or arugula, broccoli, rabi, things like that. You can get it from vegetables, whole grains, salmon, milk. Vitamin C, you can get it from citrus fruits like oranges, strawberries, cantaloupe, broccoli, tomatoes. So if you're cooking like this all the time, green peppers, you get it from that. You can make up for that. Vitamin D is from salmon, sardines, vitamin D fortified dairy products, egg yolks. Vitamin K comes from like kale, spinach, green leafy vegetables, egg yolks, safflower oil, black strap molasses. Cauliflower is very good. You can make cauliflower rice and put other things in there that you really like in the cauliflower. Soybeans, alfalfa sprouts, calcium. If you need calcium, which is a mineral, you can get that from green leafy vegetables, molasses, sesame seeds. Iron, you can get from organ meats, eggs, fish, and poultry. Black strap molasses, cherry juice, green leafy vegetables, dry nuts. So you can have like trail mix. You can find something that you really like to eat. Zinc, which is very important. You can get it from pumpkin seeds, sunflower seeds, meat, mushrooms, like portobello, different mushrooms, soybeans, wheat germ, things like that. Okay. So now I'm going to go over one last thing with you. It's just like a little tip that I saw in this book. I said, oh, this is really good because it's telling you how to mix and match things that you may not realize. Like, for example, we like to eat rice. A lot of us like to eat rice or quinoa, and we may just make the rice by itself, but we're trying to get a complementary protein combination so we will feel better, our body will be balanced in this particular nutritional item, not just if we were pregnant, but for your family, for your husband, for your children, you know? So I'm on page 218 and 219 of Anne Fry. We're going to close out after this. Okay, so it says this. I'm reading from like the third paragraph. It says, protein quality is not such an issue if one is getting sufficient calories from a varied diet. It is estimated that when caloric intake is adequate, only 20% of the recommended daily allowance needs to be complete protein. That is about 9 grams for an adult non-pregnant woman. For safety's sake, of the 80 to 100 grams of protein needed daily during pregnancy, we can assume that about 30% of that needs to be total protein, or about 30 grams a day, and maybe 60% with twins. The rest of the daily intake can come from incomplete protein sources. So I'm going to read this. It's on page 219. So it's a chart, and it's giving us an idea of how to mix services. There are many vegan suggestions for balancing proteins in the body, proteins in the food charts. Here is an additional table showing which foods complement each other. I'm glad I read this because I wanted to show you something before we go to this chart. Let me see if I can find that for you. It's talking about, like if you have a vegan diet, if you are all meat eater, this is how many vitamins you are lacking. If you eat a combination, this is what you have. And it's in here somewhere. And I want to go over that with you. And it talks about a lot of different things. It talks about if you choose whatever you like to eat, whether you're mostly a meat eater or you're a combination where you eat a lot of vegetables and you eat a lot of fruit, or you eat everything but that, what can happen to your body. So I was able to find that page. is on page 250, and it's called Vitamin and Mineral Supplements During Pregnancy. And this goes over the different types of foods a woman will eat based on what she likes, what type of eating she prefers, and what type of feeding her family prefers. So it's this type of diet, something called omnivore, which is meat. Those who eat no dairy products. It may be deficient in calcium and vitamin D. So if you are classified as an omnivore, you're eating lawful things like in Leviticus 11, right? But you're an omnivore, and you just eat meat, pretty much is like the main focus. Those who eat no dairy products. So that's what that means. Those who eat no dairy products. So it says omnivores, the type of diet is omnivore is meat, and those who eat no dairy products. So they don't eat any dairy products. But what happens is they develop a calcium and vitamin D deficiency. So a type of diet called a ovo-lacto are those who eat mainly dairy for protein. But then they lack vitamin B6, iron, and copper. So those are deficiencies that they will experience. A vegan, we may hear about vegans, those who eat no animal products, right, except for like Passover, I'll praise the Most High, may be deficient in calcium, riboflavin, B12, vitamin D, calories, zinc, and protein. So there are a lot of deficiencies involved with becoming a vegan, which is they eat no animal products. There's a lot of things that go wrong. You're leaving yourself susceptible to go wrong because of those vitamin deficiencies that we reviewed earlier. So it says type of diet, raw foods. So they eat this type of diet is they eat raw foods, but they don't eat, they're eating lawful things. They don't eat any, there's no animal products, but all their vegetables and stuff are just raw. Like if you get broccoli or you get some other things in the produce area, peaches or whatever, or apples or whatever. Nothing's cooked. But they have the same deficiency as a vegan in addition to thiamine, niacin, and B6. So that's what I wanted to share with you on that deficiency. Now let's go to page 219 of the same book. Page 219. Okay, foods. Let's talk about this. Foods, the categories are foods, legumes, nuts and seeds, and vegetables. So I'm on page 219. So the food item is grains. How are you going to prepare this complex item? How are you going to prepare this? So let me give you a refresher on that. We reviewed that earlier, page 218. It says protein quality is not such an issue if one is getting sufficient calories from a varied diet. It is estimated that when caloric intake is adequate, about only 20% of the RDA needs to be complete protein. That is about 9 grams of an adult non-pregnant woman. For safety's sake, of the 80 to 100 grams of protein needed daily during pregnancy, we can assume that about 30% of that needs to be total protein, or about 30 grams a day, or maybe 60% with twins. The rest of the daily intake can come from incomplete protein sources. In addition, the body has mechanisms for ensuring that its protein needs are met. As the caloric value of food goes up, so does the efficiency with which protein is utilized. If you are getting enough calories, the effective quality, biological value of the protein you eat actually rises. Secondly, short-term dietary deficiencies in the quality of proteins can be made up by drawing from a pool of amino acids within the small intestines, where about 80 to 90 grams of complete protein are supplied daily from the breakdown of cells in the normal course of metabolism. That was on page 218. All right, so page 219. This is telling us how we can kind of put some examples of things together that will help you to make up this area. So it says, there are many vegan suggestions for balancing proteins in the food charts. Here is an additional table showing which foods complement each other. So, like when we make like rice and beans, sometimes you'll see a recipe where it's just rice, but there's no beans. So it's not complete protein. So even if we're not vegans, it is a really good idea to consider putting some sort of beans, your favorite bean, whether it's pinto beans, black beans, kidney beans, in there to help complement it. You also will help, get enough of the other vitamins and minerals as well by adding in a bean, a legume to your rice mixed with like quinoa, cauliflower rice, something like that. So let me give you an example. If you have the food grain, let's say you went to the supermarket and you bought some grains, right? And you're deficient. So I'm deficient. I found I was deficient in essential amino acids, right? I have a deficiency and I need to get some more grains in my diet. How are you going to be able to prepare that to make sure it's a complementary protein combination? Well, you can say, okay, I need some grains. Well, I'll buy some whole grain rice. And I'll make sure there's some legumes in there. So what kind of legumes? Well, I'll put some black beans in there. I'll put some black beans in there. I'll put some black-eyed peas in there. You put something in there. Some pinto beans in there. You want to have it mixed with the whole grain rice, the brown rice, and some quinoa. Mix it with some beans. Have some cauliflower rice. Kind of mix it and have a nice combination. But rice and legumes is a good combination. If you just have the basics, right? You may have to go shopping and you say, you know what, I still got to make some sort of legumes or something or rice. Let me mix it together with what I have. You can also have corn and legumes together. So corn and beans mixed together is a complementary protein combination that meets that requirement. Wheat and legumes is good. Wheat, peanut, and milk is good. Wheat, sesame, and soybean is good. You have them all three together. Rice, and it says nutritional yeast is good together. If you have legumes, if you have just beans, right? What do you mix those beans with to make sure it's a complementary protein combination? One really good example is rice and beans, like we just mentioned. If you have certain deficiencies in amino acids. But if you're making it all like that all the time when you're making dinner for your family, then you just always have it and you don't even realize you're meeting that requirement, and then that deficiency won't happen because it's met in that area. Nuts and seeds. Let's talk about that. If you have some nuts and seeds around, or you may be packing it for lunch, or you may be going out somewhere and you need to have a snack with you. You say, well, what should I get? You think about trail mix, things like that. If you have nuts and seeds as the food source, and you have a certain deficiency in like lysine, right, which is Lysine, you can look that up. You can combine peanuts, sesame, and soybeans together, or peanuts and sunflower seeds together. You kind of mix things together, and it's a complementary protein combination. And let's talk about, lastly, vegetables. If you find that you have a certain essential amino acid deficiency, and you say, well, how can I get this, repaired? Well, you can definitely improve this by having some lima beans or green beans, along with sesame seeds, or Brazilian nuts, or mushrooms. You can mix lima beans with mushrooms. You can have cauliflower, like cauliflower rice, and just make sure you add the mushrooms to it too. Or you can have broccoli, and whatever you're making, you might have a little rice with broccoli and whatever else in there, but make sure you add mushrooms to it. And that's how you'll have a complementary protein combination. Now I'm going to go to some other areas. I was going to close up, but there's some other things that I want to talk about that we hear about in pregnancy as well as when we're not in pregnancy. It's just like a little list that's really good. Page 252. Iron sources for those who don't eat liver, right? They say, I ain't no liver. Might be law, you know, you find out what's lawful, so, oh, I'm not gonna cook that, I'm not gonna eat that. But, you know, there's other things. Page 242. Well, you can have, let me think, okay, black strap molasses. If you have 1 tablespoon, you try to get things organic if you can. If you had a choice, the best choice is organic versus the regular, because if it's not organic, let's just say you have a canned prepared meal. I don't know, canned raviolis or something like that. Meatless canned raviolis or something. Canned SpaghettiOs or something. And you turn it around and you're looking at the ingredients, and it says, okay, there's pasta in here, there's sauce, and there's salt, for example. It doesn't say sea salt. It's going to affect your body totally different. But if you pick organic raviolis, for example, then you're looking for something that says sea salt on there or Himalayan salt. That's what you're looking for, sea salt, something like that. It will affect your body differently. All right, so let's get back to this. So we know that one of the things they want to focus on is iron, you know, when you're pregnant. But even if you're not pregnant, for your family, you want to make sure you're cooking for your family, your new baby as well. The right things, preparing the right things. Iron sources for those who don't eat liver. So this is for anybody. This could be for your husband, for yourself, for your family. You want to share with other Israelite family. That's how you can share it. You can get iron sources from prune juice, like 10.5 milligrams, which is 1 cup. If you drink 1 cup a day of prune juice, you are getting the iron that you need. Blackstrap molasses, if you have 1 tablespoon of black strap molasses, you look for organic things because you're trying to avoid things like hydrogenated oil products, corn syrup products, that regular salt. If it just says salt on it, it doesn't say sea salt on there or Himalayan salt, you want to definitely try to avoid it no matter what it is. All right? You want to avoid things like that. You want to try to get extra virgin olive oil. You know, you want to get all kind of healthy things. Blackstrap molasses oil, try to get the organic if you can. There's some stores that are they have really low prices and they have organic products in there. You can get it out of, let's see. So I'll just say prune juice and blackstrap molasses. You can get it out of pumpkin seeds. A half a cup of pumpkin seeds meets the requirement for the iron sources that you need daily. Rice bran, you need a half a cup a day. You just put it in something as you're cooking. Now, if you're going to eat that and you want to cook it for your family too, you want to make sure your family has that too, because they need to learn that too, and you will help to have a healthier family. Wheat germ, you only need 1 tablespoon per day of wheat germ. All right. Sesame seeds, you're going to need a half a cup of sesame seeds to meet the requirement, but you can mix that in something else, you know, to have that requirement. Okay. So let's see. Let me go on to calcium. Let's go on to calcium. I want to go on to calcium if I can, because that's a good item. So there's lots of different things you can, there's a lot of different things you can eat that the Most High created for you, all praise the Most High, that will help to address all these things before it can happen. All right, so I'm going on to page. I'm looking for a vitamin that I would like to share with you that will help you in this area. So I'm going on calcium, right? We're going to go over calcium. What are some things where we can get good sources of calcium? We know we hear about milk, things like that. Okay, I'll give you a few things. There's a big list on here, which is great, on page 240. So if you have about 36 nuts of almonds, you are meeting it says calcium sources about 100 milligrams calcium each. Eat 1 to 2 portions for every unfortified soy choice. So this is what the instructions are for this. So you're going to have some almonds. You're going to have 36 almonds, for example, to help meet that requirement. And let's see. Fats and oils. 8 grams of fat each, right? If you want to meet that fats and oils requirement daily, eat 12 walnuts whole, or 10 cashews, or 10 almonds. You can eat 10 olives as well. You can have 2 tablespoons of, believe it or not, your favorite salad dressing. You can have 3 tablespoons of grated coconut, 1/4 of an avocado, 1 tablespoon of margarine, 1 tablespoon of mayonnaise. So mayonnaise could be on something else. And you can meet that requirement, which is really good. All right. And let's see. What I was trying to find. Let's see. I wanted to find one more thing. See if I can find it for you before I go. All right, I'll talk about this. Let's see. Fresh dark green vegetables. Here are some examples of something that you can have daily. 1 cup of broccoli cooked. 1 cup of Brussels sprouts. 2/3 cup of spinach. It says raw, so you want fresh. So when it's fresh, don't cook it in this particular case. You can always mix it with something if you want. But if you like it cooked, you cook it. Just make sure you're getting it in there. If you're going to cook the spinach, drink the broth in it. You don't lose the vitamins and minerals on it if you're going to drink the broth that you're cooking it in. But because it drops from the leaf and it goes into the water. If you can drink the broth with the spinach, then you got it. Oh, praises. Romaine lettuce, 1/2 cup. So if you make a salad, make sure you have at least 1/2 cup of romaine lettuce. 1/2 cup of asparagus. And 1 cup of, you can have 1 cup of bok choy, or 1/2 cup of watercress. And last but not least, if you are looking for vitamin C rich foods, try a cup of cabbage, cauliflower, 1 cup of cauliflower, 1/2 of a medium cantaloupe. So you might see a medium cantaloupe, right, in the store. Cut it in half and eat that. It's got a lot of water in it, and it's got a lot of vitamin C in it. Grapefruit, and it says preferably pink. If you can get the pink grapefruit, that's the best source of vitamin C between the 2 types of grapefruit. You could drink 2/3 cup of grapefruit juice. You can have 1 lemon. You can have 1 orange. You can have 1/2 cup of orange juice, 1/2 cup of papaya. You can have a green pepper or a red pepper raw, like you can cut it up in a salad. You can have potatoes. If you cook like a red potato, that would be very good. There's a lot of benefits to it. Strawberries, fresh, tangerines, tomatoes, tomato juice. And try to get things, organic if you can. Now I want to go on to whole grains, because I'm seeing all these things up here that could be helpful to you. Before you're pregnant, when you get pregnant, after you get pregnant, as you age in life. All praises. So whole grains. Whole grains provide carbohydrates and B vitamins. What are some examples of a good food source for it, and what portions should you take? Well, you can have bread, whole wheat, or rye. If you can, try to get organic bread. They're starting to make that now, and they're putting sea salt in the bread versus the regular salt, and that makes a big difference on your health. And let's see. A healthy type of cornbread that you can make from home, where you can put things like, you can use extra virgin olive oil in it, make your own buttermilk, use sea salt, use cane sugar, right, in that, and you can get your cornmeal. If you can get certain things organic, it helps you a lot. Buy a bag of organic cornmeal and then buy the regular cornmeal and just look at the quality of it. The same texture, like fine or coarse, and look at the way it looks. It's totally different. And you'll see it'll go through your body totally different too. So whole grains. So I don't see oatmeal here, but old-fashioned oatmeal is very good, because it's talking about cereal. Shredded wheat. Shredded wheat is very healthy. Bran flakes, granola, wheat germ. So it's just talking about different things. If you're going to have shredded wheat, have 1 biscuit. Bran flakes, a half a cup. Granola, a half a cup. Right? If you have puff type cereals, 1 cup of that. Wheat germ, 1/4 cup. And if you're going to eat grits, a half a cup. And that meets the whole grains requirement. So grits are very good too. Popcorn. If you're going to have whole grains, you eat popcorn, you need to eat 3 cups of that to meet the requirement for the provides carbohydrates and B vitamins. If you can get whole grain rice, you need to eat a half a cup cooked. If you're going to have something with flour in it, 2.5 tablespoons of that, preferably whole grain. Graham crackers as well. Consider graham crackers as well. All right, so I hope that you enjoyed today's class. I'd like to thank you for watching. All praises to the Most High in Christ blessed. Shalom. you.